Many people can experience pain during sexual intercourse, and it can be on the part of the man or on the woman. It's a much more common problem in women, but it's common enough in men too for various reasons, which I'll mention. Again, it can be a physical problem, and in the main it is a physical problem in the sense that there's a physical or medical cause for it. But there are instances where it can be more a psychological problem, so that's unusual. For men, I mentioned earlier when I was talking about vaginismus, most of the causes of pain during intercourse for women are things that can contribute to vaginismus in women. But in men, again, we have the general headings, like, you know, in many of these instances of inflammation and infection and tumours. So any man who experiences pain during intercourse, we need to look at various issues like, as I mentioned, inflammation, infection, physical anatomical problems. One of the most common conditions probably that causes pain during intercourse in men is a condition called phimosis. And phimosis means that the foreskin, the opening of the foreskin is too narrow and doesn't allow the foreskin to freely move back and forward during sexual intercourse. So if you can imagine if a man attempts sexual intercourse and his foreskin is the opening is tight and it can't move back easily, sexual intercourse would actually have the effect of trying to force back something which doesn't want to go, and that can be very painful and off-putting. And some men assume, for example, with phimosis, with that condition, that they automatically need a circumcision. That's not necessarily the case. Some men just are not used to retracting the foreskin. Sometimes inflammation develops on the head of the penis because they're not used to retracting the foreskin and washing the area. So often simple hygienic measures will sort that problem out. Any infection, particularly some sexually transmitted infections, may cause discomfort, inflammation, irritation in the area, and if that can be aggravated during sexual intercourse too. Sometimes men can develop various skin conditions, which are, you know, not specifically sexual things, but skin conditions that occur anywhere in the body that can affect the genitals, and they can cause discomfort and pain during penetration as well. But most of these conditions, again, are treatable. But the important thing, like in all areas of medicine for men, a message which we seem to be trying to get across more and more, but particularly in the sexual area, is that a lot of things are treatable. The important thing is that a man, if he had a pain in his head that he was worried about, he'd go to his doctor. If he has a pain in his genital area, or any discomfort or problem in the genital area, he should go to his doctor as he would for any other problem. Now, in the case of women having pain during penetration, during sex, it tends either to be at the outside, just at the entrance to the vagina, or less commonly deep inside. And where the discomfort or the pain is felt at the outside, at the entrance to the vagina, it generally is related to infection or inflammation, or maybe some anatomical defect. Or defect might not be the right word, but probably inflammation due to infection is the most common cause. And then most women, I think, are aware of what they call thrush, which is a fungal infection that affects the area, and it's a very common thing in women, and it causes inflammation in the area, and any attempted penetration when a woman suffers from thrush is invariably painful. And other infections can cause similar inflammation and discomfort. In virgins, women attempting intercourse for the first time, sometimes the problem may be related to what we call an intact hymen, is where the veil of tissue, or the membrane of tissue that covers a girl's vagina, it normally breaks down as a girl gets older because she's climbing trees, riding bicycles, riding horses, whatever. Generally the hymen breaks open and doesn't cause any problems. But for the odd woman, especially if she's a tough hymen to begin with, if it doesn't break fully during those activities, and maybe there's some of it left that when intercourse is attempted or penetration is attempted, there's a pressure on this. It's like the side of your mouth really stretched and it can't give. So that's a relatively easy one to treat, as can be, and the others can be too. Tumours in the area, skin conditions in the area, like common skin conditions that could affect any part of the skin, are a relatively common cause as well. When the pain is deep inside the woman, when she experiences the pain on deep penetration and thrusting, it's generally more related to internal organs like ovaries or womb, and that needs to be investigated obviously in the way it should be.